earlier in the week, the Wall Street Journal published a article about President Trump's health, and it was quite interesting for all the things that it said and all the things that it didn't say. One of the things was that they confused the MRI with a CT scan, and if we have time, we'll get into that a little bit later on in the segment. But also, it came out that he takes more aspirin than the doctors prescribe him to. And so we wanted to get a doctor on here to find out exactly what all that means. And not only did we find a doctor, we found one of the best. Dr. Fahmi Farah is with us. She is a doctor, but not only is she a doctor, she's a cardiologist. And you have seen her on NPR, NBC News, ABC News. She's been on Fox. She's worked with the United Nations. She's worked with the World Health Organization as well as UNICEF. Doctor, thanks for joining us here on America at Night.
Thank you for having me. It's my pleasure.
So let's talk about aspirins, because I always thought an aspirin a day was good as you got older to sort of ward off a heart attack. Is that still the case, or is it something else now?
No, it is. In the past, a lot of people used to be on aspirin, even without a reason to be on aspirin. But that thought has changed. We now ask aspirin to be taken only with a physician's recommendation. So it shouldn't be just taken by everybody. It should be individualized.
Interesting. So that was like old school. Back in the old days, you would take an aspirin a day.
Correct.
Yeah. Also, is it still true? I vaguely remember that if you take an aspirin after a heart attack or during a heart attack, isn't that also sort of helpful?
Oh, it absolutely is, yes. Aspirin taken in the setting of a heart attack can be life-saving.
Interesting. And then after you've had a heart attack, do doctors prescribe an aspirin a day after a heart attack?
Yes. We do prescribe an aspirin a day after a heart attack, and you don't necessarily have to have a heart attack to take aspirin, as long as there are certain heart conditions, such as blockages present, certain pre-existing conditions, high-risk patients. They can also be on a daily aspirin.
One of the interesting things about this Trump thing, and I know you're not his doctor, so we're not talking about him per se, but a lot of people found it odd that he took so many aspirin. And for so long, what are the side effects of taking too many aspirin?
The one that he's been reported of taking is the high-dose aspirin. It comes in 325 milligrams, and some of the risks with that one is GI-related, primarily bleeding. They can have increased risk of GI bleeding.
Any other side effects, or how dangerous is it for somebody to take too many aspirin?
The dose 325 milligrams is not necessarily to say that it's dangerous, but the major risk factor would be the increased risk of bleeding. One of the biggest ones being GI, but it could be other forms of bleeding as well. It does increase the propensity for skin bruising, for example, easy bruising. If you get a cut, you may bleed for longer than usual. Those are some of the most common risks associated with the higher dose aspirin.
Have you ever had a patient who took more aspirin than you told them to?
Typically, no.
Yeah. How often does a patient tell the doctor, hey, thank you, I know you told me to take one every 10 hours, but I'm going to take 4 every 10 hours. How often does the patient sort of not listen to the doctor?
It's usually the other way around. Typically, we have a hard time getting patients to take enough of what we're asking them to take. They usually don't take more than what we ask them to, because most people don't like taking medications.
What is it? Let's talk about the heart in general. We often, because one of the things Trump said is that he doesn't like thick blood. He likes thin blood. Does an aspirin thin the blood?
It does. It does act as a blood thinner. So yes, it does thin the blood, and that's part of the reason why the risk of increased bleeding is there.
Interesting. What about like Eliquis? What's the benefit of Eliquis over an aspirin, and or vice versa?
Eliquis is also a blood thinner. It's a different class of blood thinner, and actually Eliquis is a much stronger category of blood thinner. Typically we use it for very specific scenarios For instance, if somebody has a blood clot in their legs or arms or somewhere in their body, or even a blood clot in their lungs, that's used, Eliquis is used for dissolving that blood clot. Eliquis can also be used for stroke prevention in a certain subclass of patients who have a condition called atrial fibrillation. It's a type of arrhythmia. People who have it, they tend to form blood clots inside their heart, and that blood clot can then travel to the brain and cause a stroke. And so to prevent that from happening in those folks, we typically prescribe them Eliquis to thin their blood so that they can, their risk of stroke can be minimized.
Let's talk.
It is different
Go ahead,
from
I'm sorry.
aspirin.
Yeah. Let's talk. Yeah, let's talk about AFib for a second, because AFib seems to be everywhere. We see a lot of commercials advertising for Eliquis, which is AFib, but anecdotally, I know quite a number of people who are suffering from AFib. Has it been around? Is it something new? Why are so many people being diagnosed with it these days?
AFib is something that has been around for quite some time. It is not a new diagnosis necessarily, but yes, we are seeing an increased rate of atrial fibrillation, especially post-pandemic. So it's quite possible that the virus had a role in this increased rate. The other thing is, usually in the past, we used to see atrial fibrillation more in the elderly folks. Nowadays, we're seeing them more and more in younger people as well.
Once you have AFib, how do you get rid of it? Is there a way to get rid of it? How do you, besides taking Eliquis, is there a way to sort of get out of AFib?
There is. AFib is, there's a wide spectrum of treatments that are available for atrial fibrillation, and it is all dependent on how severe the atrial fibrillation is and what kind of symptoms the patient is having, as well as what kind of complications they are suffering as a result of the atrial fibrillation. So the spectrum goes, it could be as simple as just controlling their heart rate with an oral medication that is very simple. And it can go all the way to, shocking the heart to get them out of atrial fibrillation. If that doesn't work, then we can also do a procedure called ablation. It is an invasive procedure where we go and we basically burn off a piece of the heart, an area of the heart that's responsible for causing that arrhythmia. That's called ablation, and that can actually get rid of atrial fibrillation.
Are those how well do those work?
They're fairly effective. They usually have about an 80% success rate.
Is it dangerous to stay in AFib for years, months, days? What's the long-term prognosis of it?
The long-term prognosis is actually not bad in atrial fibrillation. The main thing we worry about in atrial fibrillation is stroke. So as long as the patient is not symptomatic and they're being treated properly by blood thinners and their rate is controlled, then a person can stay in AFib for long periods of time without any issues. But if they have complications such as reduction in heart function, like if they have heart failure, those would be the reasons and times to get them out of atrial fibrillation by procedures like shocking the heart, medications, and or ablation.
It's really interesting. So we've seen an explosion of AFib after COVID-19. That's really interesting.
It is. In fact, after COVID-19, there's been an increased rate of heart disease across the spectrum.
Is it because we didn't do anything for 2 years, or is it some connection to COVID or some connection to the vaccine? Do we have any idea?
The thought is it's multifactorial. There is part of that, the risk factors went up in those couple of years, lifestyles changed, but also there's a thought that the virus itself is playing a role by damaging the cardiovascular system.
Really interesting, Doctor. So just so we're all on the same page here, because one of the reasons why we wanted to get you on the show, we wanted people to get the right information about an aspirin. Obviously, check with your doctor, but there is no need to just run out and start taking an aspirin. And an aspirin after a heart attack makes sense, but taking more aspirin than the doctor orders really doesn't do any benefits for you.
That is correct.
Yeah. It's kind of like me with like fertilizer on the lawn, right? A little bit of fertilizer is good. A lot of fertilizer is bad.
That's a very good analogy. I like that.
I only know that because I've done it. One Reese's Pieces is fine. 4 bags of Reese's Pieces, not that good of an idea. Dr. Fahmi Farah, medical doctor in Fort Worth, Texas. Of course, she is world-renowned cardiologist, and she's helped out the UN, the World Health Organization, UNICEF. She's been all over the place on Fox News, NPR, NBC News, ABC News. Doctor, thank you very much for your expertise. Happy New Year, and thanks for checking in.
Thank you for having me. It was my pleasure.
You got it.